One of the most irritating parts of the patient journey is when you walk into a room and the doctor says, "What can I do for you? Why are you here today?" And the patient immediately thinks to themselves, "I've told everyone, I've told the person who works for you, I've sent in my records." And so the training that we bring and conversations we have, and it connects to the brand, to your question, is we will encourage our clinicians to start conversation by saying, "Listen, we spent a lot of time getting you here today, and we have a pretty good sense of what brings you, but I'd love to hear in your own words, what do you want to get out of this today?" Honestly, check 5 seconds more at most. Helps the patient feel better, just put us in a good place. Yeah. That brand, that and conditioning. So, we don't walk in and say to a doctor, "Uphold the Cedars brand." What we do is we talk about how to make the patient experience better, and that in turn helps the brand.
Welcome to another edition of the Health Beats podcast, supported by the Abu Dhabi Global Healthcare Week, where we actually find ourselves today at the event itself here in Abu Dhabi. My name's Steve Gardner. I'm the Managing Director of Healthcare World magazine, and I'm your host here on podcast. And if you haven't already subscribed to Health Beats, why ever not? You can find us on Apple Podcasts, Spotify, and all the other wonderful places you can find podcasts. I'm joined for what will be another fascinating debate and a conversation by two giants of healthcare. Noha Hacach, who is the Managing Director for the Middle East for Cedars-Sinai, and the Vice President of Patient Experience, Alan Dubovsky. Welcome to Health Beats, both of you. Thank you for joining us. I think there is only one place to start. Yeah. What is a Vice President of Patient Experience?
Great question. Well, thank you very much for having both of us. It's a pleasure to be here today. Vice President of Patient Experience, it's a relatively common field now in the US over the last few years. It's taken off significantly. The job of the patient experience leader is, in my opinion, to make sure that the voice of the patient is included in all the work that we do every day. So my team and I are responsible for two big things. Number one, ensuring that voice is present in all of our decision-making, in all of our operational improvement, et cetera. And secondly, to really look and listen to the patient feedback in very deep ways, and Joe will get into this a little, and to make sure that feedback is used to close any gaps between what patients want from us and what we're providing. So to really make for the ideal experience. So long story short, helping meet the strategy to improve the patient experience across the health system.
And of course, you come to us directly from Hollywood, California.
Yes, bright and shining up the stars of Hollywood Walk of Fame.
And Noha, you're based here in the Middle East. So
covering the GCC, yeah.
So explain to us then the relationship. So Cedars-Sinai as an organization is a US healthcare provider, but you've set up and are running here an outpost of Cedars in the Middle East. What is that and how did that come about?
Sure. So as you did say, thank you. Cedars-Sinai is a leading hospital in the United States. We're very proud of all the accolades and achievements that we make. But most importantly, we anchor around excellent patient care. And with that excellent patient care and excellent patient experience and patient journey. Cedars-Sinai is not new to this region. We've been taking care of patients from this part of the world and in fact, internationally for many, many, many years. But what we've done more recently, I would say, since our chief executive has taken over, Dr. Haytham Hassoun in the last 5 years, is really try to be more visibly present and active in this part of the region as well. So what we've been doing is anything from advisory support to hospitals wanting to elevate their level of clinical care service lines, working to help them improve operational workflows. We have an affiliate in Qatar that we're very proud of with the View Hospital, and a lot of academic collaborations as well. So it's a myriad of different collaborations and opportunities, and being present in this region is very important for us. So it's not just working out of Los Angeles to support here, but really being physically present. So we have teams on the ground, kind of with our finger on the pulse, understanding what the market needs, customizing and personalising for this region. And with that, patient experience is a big area of interest and an opportunity where we believe that we can bring some of that excellence and achievement that we've done in Los Angeles, but very much personalizing it for here with all the cultural nuances. And we always believe in meaningful collaboration. So it has to be bi-direction. We have to learn from the region and share with the region. It's bi-direction.
I think that's a hugely important point you raised there. When you look at the Middle East and its healthcare systems as a whole, this is not about selling the US experience or selling the US product to the region. It's about creating that bilateral partnership and seeing what we can teach and what you can learn. Having said that, of course, you've had a lot of success in States with your patient experience programming. And there's a lot of opportunity. I think the reason you're here this week is to talk about that success and how that translates regionally. So do you want to start by explaining the process, strategy, what you've done in the US?
Yeah, happy to. So, the way we have thought about packaging our program, and to answer the second part of your question, what a lot of people are interested in learning is what are the core pieces of a patient experience program, a successful patient experience program. So in my 8.5 years at Cedars-Sinai, I've been very fortunate to build the experience program for the brother. A lot of lessons learned along the way. So now what we're helping other organizations think through is whether you're starting from scratch, starting over, want a little bit of reread, essentially get anywhere on that spectrum. What are those more pieces that you may want to think about? So, for example, how do you structure the governance of a patient experience program? How do you think about all the things patient feedback? What should you be listening to and who should you be listening to and how do you report that out internally? And then how do you work on improvement projects? And how do you get your organization to buy into this idea of experience? And so our story, which frankly isn't perfect, but I think we've done a really great job of it the last few years of putting together the core pieces that have brought us to exceptional experience results, strong organizational value. That story is what we've been partnered to break to the international stage, or one of them. We've had a lot of success regionally, California, in the US. And my experience having attended Arab Health, even 5-6 years ago, this idea of patient experience was starting to come up a lot. Everybody had questions, and the questions were a lot about, right approach and right attitude, but maybe some of the missing pieces of what do I need to start with. And so the courses and the workshops that we've been facilitating in the region for the last 12 to 18 months are really helping organizations do that. I will say, to connect to the question before, I'm learning as much as I'm teaching when I'm out here. So yesterday we hosted a workshop in collaboration with SSMC. Great audience, great engagement. And we would teach and talk about our successes. And then group discussions would yield so many great ideas from everyone in the audience. But I'll say, sort of to close all of that, I think what's lacking in the world of patient experience is that international platform where people can learn from each other. A lot of the other business units and service lines have that. Patient experience doesn't really have that stage. And so I think what we're able to do at Cedars-Sinai is, take our great story, put the audience in one spot to be able to learn from each other. Because there's no real competition. We're all just trying to make for a great patient experience here. So it's been a really fun journey to think about it that way.
Is there a similarity? Is there a synergy between the US and the Middle East from a healthcare delivery point of view? They both are insurance-led systems. Both are heavily reliant on private sector providers. Is that something that helps this translate? No?
So I think they're similar, but they're also a little bit different still. I think definitely there is that strong private sector presence in some parts of the GCC. Others are still a little bit more government-based. But I think what's a little bit different here is that it's still all guided and overseen quite heavily by the government, which is not a bad thing, it's a good thing. And it allows the infrastructure to develop in terms of also beating out quality and safety and outcomes. And I think that's why patient experience is now making kind of a stronger entry point, because now how do we differentiate? How do, there's a higher expectation for patients here in terms of the experience and the luxury and the customization to the culture and the gender nuances and all of that, the expectation here is higher, I believe. And something that we also talked about yesterday in the workshop is the family is also very heavily involved in this part of the world versus the US. So I think similarities do exist. Differences are also quite pronounced. So it's really how do we take the global standard and shift it and customize it here. We're definitely learning a lot, and we're also identifying opportunities where we can lend towards more value add in this region as well.
I think there's been a theme that's come out of a few of the conversations I've had around the international healthcare scene over the last 6 or 12 months now about the consumerization of health. So the idea that actually we have a customer base, extensive now, who are becoming more demanding of our healthcare providers in terms of the experience that they get, what they expect from clinicians, what they expect from facilities, and what they expect particularly in innovation. So in terms of more preventative care, more population health, understanding of how their data is going to be used. Are those things that come into your thinking when you're talking about customer experience?
Yeah, definitely. I think you're spot on. I think what we see, and it's no different than our own bias, right? I mean, if you think over the last even 6 to 12 months, the technology that, is rapidly evolving, how we use that technology to make our lives easier, to make every day feel a little bit different. I was just on a data handle and the statistic, which I couldn't quote if you made me, but about the amount of data that existed on Earth from sort of creation until 2003 is now the same as being developed every 2 days, right? In the amount of output. And so I think to connect it to your question, patients and consumers, they know that. So they see that every day in their life. And I think what they're becoming frustrated with in the healthcare delivery system, rightfully so, is that we don't move that quickly. A lot of what we do and how we provide care, is similar to what it was 5 years ago, 10 years ago. Now, to be fair to us, it's not as easy, right? You build a bricks and mortar building, and to change that is not merely easy at all. But we should be paying attention to what our customers want. We should be thinking about them in terms of they are consumers. I don't love the term for patient experience when you talk about it as a consumer, but I use that term a lot because I want people to remember that these are people who have a choice. The choices are becoming rampant. Here, something like we are this week. There are a lot of people who are providing exceptional care. And if you don't get it right, or you're not doing it in a way that is quick enough, easy enough for the patient or the consumer, they will go somewhere else. It's no longer good enough to just be outstanding at the clinical care. You have to be exceptional at the patient experience. You have to be great at technology. And so part of my job is to remind our team that they are consumers. They have a choice. And we need to not rest on, reputation alone. Cedars-Sinai is exceptionally well known, and our reputation gets us very far, but it's not everything. And so part of the reason why we're on this journey together is to keep pushing ourselves to be, constantly a few steps ahead of everybody else, so that we don't fall behind in that super expectation.
And I just want to add to that, actually, exactly to Ali's point. We know at Cedars-Sinai, we have excellent clinical care. We know that we offer, some of the best outcomes from complex cases. But we also know that our international patient population that we very much welcome and appreciate also have choices across the United States. So some of that learning that, us sharing here, but some of that learning is what we've taken from this region and actually factored into our workflows at home. So at Cedars-Sinai right now, we have a patient lounge that is a very high touch, direct to patient experience. So that patients that come, especially from this part of the world, and, it's already tough going all the way over there with your families for, some severe diseases, is to have people to take care of them, somewhere to sit, somewhere to be looked after, prayer rooms, healing. So we've actually built that into our existing facility over the last 2 years because that's us also trying to differentiate and listen to the patient needs. As you said, it's not just enough to be excellent.
I think there's a really interesting point as well when you think about the dynamics of them. They're the key players in healthcare, payer, provider, and patient. Is it true to say that historically, the payer and provider were far too busy having an argument that who pays what, how, when, and that the patient got forgotten in that triangle? Was that fair to say?
I do think so. I think because, I'll speak for the provider part. I think it was well-intentioned, right? I mean, they were all sort of praised in this world, and we are trained to make people better. And so it's okay that we are the decision maker. People come to us with lack of knowledge, lack of understanding, and it's our job to be sort of confident in that. I think that still is true. But what we've come to realize, and I think, I know we're 5 years on, thankfully, but clinical was the thing that taught us that more than anything, which is you can still be very humble and say you don't know everything and bring the patient voice into that conversation. You don't have to be the one doing everything to the patient. Patients want to trust you with their care, but they also want to feel like they're part in the process. And I think for us, in the day-to-day tactics example, when we deliver care to the patient on the inpatient space, the experience outcomes and experience measures skyrocket when patients are a part of that conversation. So when nurses are doing sort of, for example, like bedside shift or nurses are going off duty, the next one's coming on, historically, that would be done at the nursing station. Now it's done at the bedside. And the point of that is that the patient feels like nothing is done to them, it's done with them. I think the payers, to answer your question, are climbing along on that journey. And I can speak for the US. Patient experience is now one of the standard measures of almost all of our payer contracts. How seriously they take it upon the future of that is, I don't know. And I don't think patients have caught on. I think they still feel like it's sort of an us against them in the payer world. But my hope is, not to sound too corny, but the future is sort of the payer, patients, and provider. We're all trying to get the same outcome here. We just want people to be better and have preventive care so that they don't get sick. I feel like that is much better today than it was a few years.
It's a really interesting one. I was having a conversation only this morning, actually, about the need to drive towards outcome-based payment models, towards value-based healthcare, and that traditionally payer and provider are almost traditional enemies. Or certainly they're coming at things different incentives and from different perspectives. And almost in that conflict, where does the patient sit? Does the patient actually have a voice? Do they count? But there's also, is there not, a point about how much voice you can give a patient? Ultimately, customer feedback, let's call it that, is valuable. But one of the jobs of a clinician is sometimes to hurt somebody. I've got to stick a needle in your arm. That's not going to be pleasant. Yeah? Equally, in this region in particular, there is a historical, cultural issue around patients going to a doctor, the doctor not giving them the diagnosis they expect and they want. So they just go to another doctor and another doctor and another doctor until they get the answer that they require. So how do you balance that requirement, that absolute necessity of doing what's right for the patient with the idea of giving them a positive experience that they can press the happy emoji at the end of their customer experience journey?
Yeah, it really is a tough challenge. And listen, I'm not a clinician. I've worked alongside them for 2 decades now. I don't envy that. It's a really tough place to be. You get trained your whole life to be very, very good at what you do. And then to think that at some point someone's going to come in and say, clinical care aside, give them a good experience too. And so the starting point actually is one of the challenges is I've had in my career doctors, nurses say, like, I'm not here for the experience, I'm here for the clinical care. And so part of my job is to bridge that gap. And so to answer your question, I think what we try to do is do a whole lot of skills trainings at coaching, right? How do you have those difficult conversations with patients? And frankly, it starts before the experience. It's one of the things we've done at Cedars-Sinai, and we talked a lot about this in yesterday's workshop, is we actually publish our patient experience ratings and scores of comments online. I think it's very important internally for us to be transparent that with our consumers and our patients so that they know what they're coming in for. You might not be coming in for everybody to fix you. You might be coming in for the best that we have to offer. You might be coming in for a harsh dose of reality. You might be coming in for something elective but straight. But at the end of the day, you should know what you're walking into as a patient. So the expectation setting is huge. We have many specialties where we are not going to be able to cure you. We are going to be able to make you very comfortable and be able to have a nice healing space for you to feel good about yourself. And so I think, sort of short answer to the question is the two components come together. Better expectation setting for patients so that when they walk in the door, they don't have wild expectations of what's to come. But 2 is also the skills for our providers to be able to make niches feel heard and listen to, but in a space that they can still feel like they have the clinic power to do what's right for the patient, not just what the patient wants from them.
And I will add, I think if we want to look at this within the region here, I also think it's almost like a maturity curve of what this market dynamic has been and is becoming. So, in the past, you probably go to the physician get the answer they want or not want and say, okay, I'm going to get an opinion, but maybe not even locally from the US or from the UK or from wherever. I think there is a component about educating the patient and the family and just the community about really setting those expectations with your provider. And it is an iterative process. I think it's taking time, it's growing, and it's a confidence level also. Don't forget this, especially in the GCC, a lot of the healthcare providers are expats, right? So it's a different dynamic in the market. It's a different level of comfort of communication. There's high turnover. So all of that really factors into elevating that whole level of communication, patient experience, patient expectations, and a lot of awareness and education that needs to go with it in this community.
And one I'd add, if I may, is ultimately part of it is a bit of self-awareness. I think we in healthcare, for a long time, we were very sure what patients thought of us. And we just sort of, assumed that what we thought of ourselves, patients thought of us too. A big part of the patient experience in the world, and I found this to be true in the US and in my heart internationally, including in the GCC, is that sometimes that self-awareness isn't exactly spot on. It's a part of our job is to put patient feedback in front of providers, in front of the organization to say, patients may love these 50 things about you. These couple of things we could do differently, and that's okay. And that's where we need to focus. And so I think that, closing that gap again, that's been really helpful too.
It was a really interesting point about the way in which healthcare has evolved, not just in this region of the US, but globally. You go back 30, 40 years and you had your trusted GP, your doctor, your family doctor, who would come out in the middle of the night and, to go and check, check whether your kids have got measles or whatever. And now we've gone away from having that individual relationship with a specific clinician to having a relationship with a whole provider or sometimes a whole provider network.
Right.
I guess what's missing or what's changed there is the trust piece. So how do you, in an environment where you might never see the same clinician twice, how do you build that trust?
Yeah, I think a couple of things, right? I think the way in which you talk about your health system in pure marketing terms, I should say, I think is incredibly important. Like you're building brand awareness. And this is a thing that I think we can learn other industries. And frankly, something I've seen the GCC get very right, the US for learning from, is how do you describe yourselves to patients so that when they choose you, they can describe your brand the same way you describe your brand. If you say, what are the top 3 things you think of when you think of Cedars-Sinai, you want people to feel the same. You want people to sort of line up with what you're trying to achieve on that. And I think that goes a long way because that creates automatic consistency in the experience. If I know that every time I come to Cedars-Sinai, it's going to be exceptional care, sort of an easy process, and it's going to be warm and caring, then it doesn't really matter who I see. I sort of feel like it's going to be that whole process. From a very tactical perspective, I'll tell you, when we're on the ground at inpatient units or with our physicians, those handoffs are incredibly important too. So when you talk about, I'm Alan, I'm going to be checking you in today. Thank you so much for choosing Cedars-Sinai. In a minute, Dr. Hacach will be in the room. She's fantastic. You're in great hands. If you're building that trust automatically without making it overly obvious, the patient doesn't necessarily have to have the relationship with that person, but you're explaining to the patient how everyone that comes into contact with them is connected at the back end. Because I'll tell you, our biggest patient challenge or opportunity is, it's a very simple question. We ask patients, how well do they feel like the staff work together to care for them people? And across the US, and I thought I would be, wouldn't be surprised if this was worldwide, scores are pretty low. Patients feel like it's a bunch of different people taking care of them, and they just don't feel like we are communicating. And so when you explain to patients that we are, because we really are on the back end talking to each other, you build that trust, you build that awareness. And it no longer becomes about that one doctor, the one clinic that you have to see. It's actually Cedars-Sinai urology or Cedars-Sinai orthopedics. And it's okay if you see someone else. So you've built that sort of consistent experience across.
And I just want to add to that. I think also the evolution of healthcare, to your point, is also, with medicine and science and advancement, we've also had the privilege of having a lot of subspecialization, right? So before we used to all have that one family doctor that we kind of go to for everything and hope that he knows everything or knows enough about everything to take care of those rare diseases or that one-off, disease that you're going to have symptoms for. So I think that subspecialization is to the benefit of everybody, but then it becomes harder because as a patient now you have a lot of different interactions. So one is the communication, one is the handoff and continuity of care. One physician is traveling, he's handed off to the right person. It's all about the communication. But I think what also helps that is all the technology behind it. So, probably 20, 30 years ago, there's a paper folder in a doctor's office that nobody else can see. Nobody understands what's going on. Now we're all connected digitally through EMRs and through different technologies that allows physicians to, although maybe not fully perceived by the patient yet, to continue to improve on that, is how do we all connect to provide the best patient care?
So it's a really interesting point as well that, the last time I looked, there wasn't a module in any medical degree or nursing degree about branding or patient communication or marketing. So how do you, and I get that when you've got frontline staff, receptionists, porters, those who are in, I guess, what you call customer-facing positions, that's a key part of their training and their ability. But how do you take these, let's be honest, highly skilled, highly developed, highly intelligent, occasionally quite arrogant individuals that work in specialized clinical roles and say to them, okay, you've got to uphold our brand values. How do you do that? How do you even begin to do that?
Yeah, this one I can answer having learned the hard way early about. So what you don't do.
By the way, I noticed the way the Noha instantly is asked that question, turned and looked straight.
Sure.
I'm not answering this one. This is your.
I wish there was someone I write actually.
That's his tough job every day.
No, all kidding aside, but you do learn. It's the school of hard knocks, right? You come in and you say, "Hey, doctor, X, world-renowned surgeon, be nice, sir. Your scores doesn't work. It doesn't land. Nurses who are completely, overwhelmed with the amounts that they have to do in terms of patient care documentation." For us in the world of experience, and again, something we've talked about with our international colleagues and friends, and it's similar, I think, US and other regions. And what you do is you help them understand how good patient experience actually improves their practice. So for me, the lesson learned was never make it sound like one more thing to do. It will not fly, right? Go practice, go, provide do your surgeries, do everything, and then do this extra thing. Not going to happen. What I can tell you is if you use these words or say things this way, or if you build better expectations upfront, what you will find is fewer patient portal messages for you to respond to when you get home at night, fewer calls to your practice all day long, fewer patient complaints. And so a core part of our patient experience program is really linking everything back to some sort of other metric. I learned as well that, while patient experience outcomes are great and super important, they cannot be a standalone metric. It's nice to say your patient experience scores have improved. If in this day and age, you're not able to tie it back to some sort of financial improvement or, productivity engine for a physician, it's going to go nowhere. And so what I am able to show is, for example, if we are better at the experience of discharging patients from the hospital, they're happy to leave quicker. They don't have questions when they come back. They don't get readmitted as often. And so you're able to really help providers who are confident in the care that they provide, that doing it a slightly different way that benefits the patient actually benefits them as well.
And I think here it's important, in the GCC, because patients very much have a choice here as to where they're going to go, right? So if you go to that profile of physician and say, but, we're losing patients, or they don't want to come back, or these are the complaints that you're receiving, and that's not good for you or for the hospital, then, as you said, it ties to something more important overall. But what we notice here that's probably a bit different than the US is also the dynamic between allied healthcare professionals and their physician. That dynamic is, it's a little bit different in this part of the world. In the US, it's more on a team level, but how do we communicate better as a team? I think here it's more hierarchical. So how do we bridge that and make everybody work more like a team as well? So there are different nuances to that as well. And building that patient experience education to improve that dynamic is very important.
You talked earlier in the conversation about brand. And brand is a much more complex issue because at the end of the day, building a brand requires consistency. And it means that the message has to be the same every time, and it has to be consistent every time. Is that something that you can train into clinical staff? Is that how you do it? Do you train clinical staff in the brand, in being a brand ambassador, in getting this to others? And how do you do?
Yeah. I mean, I think the answer is yes. I would say more of that focus is not necessarily on the clinicians. What we do is help the support team that's around them, right? So, for example, we spend a lot of time training front desk, is scheduling. The schedulers are a great example, right? The people who are booking the appointments are the ones who can establish the brand of the clinicians and the get-go. So they can say, thank you for choosing and coming to Dr. Dubovsky's practice. Here's what you can expect. Here's how it's heading. They're building that brand from the very beginning. The patient decides to seek care.
Earlier in the conversation, you used the phrase, you're in great hands. Which in itself is just a very, very simple way of providing somebody with an evidence trust of confidence.
Yeah, I don't want to, certainly don't want to minimize the patient experience role because I think there's a lot of sophistication. And sometimes it's honestly simplest things. I'll give you a quick example. Patients are always frustrated because they feel like by the time they get to see a doctor, they've waited months. They've either been to a bunch of other people or they've sent in all their records. And one of the most irritating parts of the patient journey is when you walk into a room and the doctor says, what can I do for you? Why are you here today? And the patient immediately thinks to themselves, I've told everyone, I've told the person who works for you, I've sent in my records. And so the training that we bring and conversations we have, and it connects to the brand, to your question, is we will encourage our clinicians to start the conversation by saying, listen, we spent a lot of time getting you here today, and we have a pretty good sense of what brings you, but I'd love to hear in your own words, what do you want to get out of this today? Honestly, check 5 seconds more at most. Helps the patient feel better. Just put us in a good place. Yeah. That brand, that and conditioning. So, we don't walk in and say to a doctor, uphold the Cedars brand. What we do is we talk about how to make the patient experience better, and that in turn helps lead the brand.
And it's more about the feedback. And I think that's why it's important to have patient experience units, departments, whatever you want to call it, in any facility, because those are the people that spend their time looking at what's happening, reviewing, auditing. And then I don't think you can train once or you can continue to keep training. I think it's the feedback loop. It's continuously giving feedback, sharing, either individually or as a group. And that is important because, they're busy with so many other things. It's just not about bullying them with the training.
Yeah.
I think it's a really interesting point that we live in a world where we have access to information, where we can look up the consumer rating score for every product on Amazon. Yeah. And in Gen Z, we have a whole generation of people who are out there and savvy enough to go and hunt down the thing that they want and understand what's important to them. Is what you're trying to achieve here a direct result of that consumerization, of that demand from patients for more?
I mean, I think so. I think we would have done it anyway. I think we were realizing that, the industry, again, just to connect back to the sort of resting on your laurels piece, it's not enough. And I think realizing that people were always going to want more. And the other thing is we've all experienced it in our own personal lives. I mean, you see how everything just becomes easier. And you have it everyday life. Why should you have it in healthcare? Why shouldn't it be that way as a patient? But yes, I mean, I think, again, we've learned a lot of lessons over the last few years. And the big one for me is that patients are rightfully demanding ease. They just want to ease. One of the statistics we talked about yesterday is close to 50% is 48% of patients report having some sort of friction in their experience before they even set foot in the door of hospital medicine. This is a US figure. And so, and when they have friction, the experience outcomes drop dramatically. And so if you can remove that, make it a lot easier. So that's part of our job, right? Is from an experience perspective, is to create that ease and consistency. And I think patients have told us that loud and clear. We're paying very close attention to it. So yes, I do think they're pushing us for a brief to make life a whole lot easier.
And no, I'm really interested to understand from the perspective, your perspective in terms of as somebody has been at the shock and delivering kit, what are the biggest vibes? What are the things that come up time and time again when you look at patient experience? What is it that people are complaining?
In this part of the world, I think what we're hearing a lot is one, the communication. And I think that's part of it. One, it's part of it hasn't really been an expectation that has been delivered on. And two, don't forget this part of the world, and I see that a lot of people from a lot of different backgrounds, a lot of different training, a lot of different education, all coming together. It is a melting pot, as cliche as it sounds, it is. And so trying to standardize and unify that way of dealing with patients, or the culture of dealing with patients. You have cultures where the patient just walks in, the doctor says a few words, and that's it, be on your way. And other cultures where they take the time to explain. And so those variations in the delivery of care, it's not to say that the quality is different, but just the delivery of care is also how do we standardize it to elevate that level here. I think another part of that is also, I mean, as you said, that perceived arrogance. I remember once I was speaking to a hospital director and I said, there's patients are complaining that, the way the patient's slow, the journey is like, I don't see them complaining the elevators are full. So that whole sitting on your laurels thing. So it's really about changing that. And I think there's a lot more, as you said, there hasn't been a lot of focus on training and capacity building in terms of frontliners in the realm of patient experience. They're great clinically, but there really needs to be focused effort on training, networking, bringing together, sharing. I mean, yesterday we had a room of 70 people sharing experiences, lessons learned, challenges, things that they've looked at. And you suddenly saw a very vibrant conversation. They probably never had an opportunity to sit and have those conversations ever before. So it's really bringing it all together and learning.
And in some ways, it sounds to me as though one of the positive experiences there was actually giving people the time to think about their customer experience, their patient experience, giving the time to think in a way they probably never have before about how those patients are feeling them. And time is a really important factor now too, because we're out of it, which is a shame. I only have one more question. If you were to rate the customer experience of this podcast on a scale of 1 to 5, how good was your host today?
Oh, well, 5.
I would give you if there was a happy face emoji, I could click.
The airport buttons.
So we both appreciate the opportunity to talk about this, such an important topic, yet such an important.
And thank you so much for taking the time to do this. So that's another edition of Health Beats out of the way. Another opportunity to discuss a really important and really interesting topic with some people who really know what they're talking about. And there are a hell of a lot of people on the Health Beats podcast who know what they're talking about. You can get so much more of this by subscribing on Apple Podcasts, on Spotify, all the other podcast places you find stuff. And until the next time, I'm Steve Gordon, Managing Director of Healthcare World, Noha Hacach, and Alan Dubovsky. Thank you so much for your time.
Thank you so much.
See you again soon. Thank you very much.
Great being here. Thanks.